My name is Mario, and today I'm going to be explaining the basics of the automated external defibrillator, also known as the AED. First of all, AEDs should be located at every athletic venue, every hospital, every sports medicine clinic, even mostly at all job sites. So what AEDs are used for is it delivers a heart rhythm, it delivers a shock to the heart to kind of get the heart going again. And most times you're going to use this when the heart stops and a patient is unconscious and not breathing. So first things first, when you come upon a scene and the patient is on the ground, you want to make sure to survey the scene first of all to ensure that your safety is fine and you're not going to do any damage to yourself or anyone else. After the fact that you've made sure that the scene is safe, you're going to want to walk over to the patient, check their responsiveness, see if they're breathing, see if they have a pulse. If not, then you want to go ahead and send somebody to get the AED. While you send that person to get the AED, you're going to want to go ahead and perform CPR on the patient until the AED arrives. Also, you want to make sure to send someone to activate EMS. So when waiting for it, you're going to be doing that CPR, and once the AED gets there, you're going to want to clear the area. Make sure to set the pads up on the patient, and you're going to be setting the pads up on the upper right chest and then on the left side just below the ribs. There are precautions to setting up the AED. You want to make sure that the patient is dried off, have a dry chest, take off not all clothing, but you just want to make sure that the area is bare and there's no clothing guarding the areas where you're going to put the pads. And if there is hair, you're going to want to make sure to shave the hair off because you want to have it directly on the bare skin. So what the AED does is it analyzes the heart rhythm to basically see if it's there or if it isn't there. And the AED will do all the work for you. It will let you know whether the shock needs to be advised or not. So basically it has the on-screen audio, and some AEDs have the visual prompt that shows you exactly what to do step by step. You just need to know where to place the pads, how to get the AED, and how to put it on and check for responsiveness. So if the shock needs to be delivered, there is a button on the AED. For our sake here, this isn't a practice AED, so I won't be able to show you guys. This is an actual AED. There is a button that delivers the shock itself. You press the button, it will deliver the shock, make sure everyone's clear from around the area. That is another precaution to take because you don't want anyone else getting damage in the area. And you want to also make sure that there is no wet surface that the patient is on. You want to get the patient onto a dry surface. So once that is all done, the shock is delivered. You want to reanalyze the patient to see if they have a heart rhythm or not. If not, I believe that you do CPR on the patient, or you check if they need another shock or not. That's it.